For most of us, it's scary to imagine losing a limb, but this is the reality for 15% of diabetics. Why is amputation more likely for diabetics? Because they're more likely to get foot ulcers and other foot, arm, and extremity wounds, and as a result, undergo amputation procedures in order to avoid further complication and maybe even death. For many diabetics, amputation becomes an unavoidable treatment for diabetic ulcers that are either chronic or were never given the full attention they needed. The good news is, in recent years, the rate of lower limb amputations have lessened in the United States, and that's because people are learning how to prevent them. Now, it's estimated that around 70,000 diabetics undergo amputation on a foot or leg each year. Even still, for those who lose a limb, it leads to pain and a host of emotional issues, including trauma, grief, embarrassment, and confusion. In this video, we're going to explore the importance of wound care when it comes to diabetic wounds. As with any wound, finding a good, trusted doctor is crucial to getting care done efficiently and in time. High blood sugar plays a significant role in diabetic injury, and then proper wound care becomes essential. For diabetics, high blood sugar levels lead to wounds and infection, simply because the body is more vulnerable during a blood sugar spike. Injury prevention becomes essential and unavoidable in order to keep in the best health. If wounds do occur, it is crucial to seek treatment immediately. The most important thing for diabetics is to keep wounds clean, and this is truly the best way to protect the body from diabetic amputation. What is diabetic neuropathy? Neuropathy occurs for a majority of diabetics. It's estimated that 70% of diabetics will develop the condition in their lifetime. Diabetic neuropathy is nerve damage, and it greatly increases future risk of limb amputation. The reason neuropathy occurs so frequently in diabetics is that high blood sugar destructs the body's nerves and blood vessels, and therefore, the way that oxygen is delivered to the nerves. What happens for diabetics is the nerve damage becomes so bad, so extensive that the body can't efficiently handle the signals it needs to handle. Now you might be thinking, what does neuropathy feel like? For most diabetics, the signs of diabetic neuropathy are easy to recognize. It causes tingling and numbness in the extremities, hands and feet, like the person can't feel anything. It also has other, lesser-known symptoms. Here they are: shooting pains, burning pains, stomach issues, including vomiting, constipation, or diarrhea, sexual dysfunction, urinary issues, dizziness when standing, dizziness while walking, sensation of wearing a sock or glove when you're not wearing one. This is also called invisible sock or invisible glove. Trouble sleeping due to pain in feet and legs. Poor coordination. Difficulty walking, poor movement in the arms. Why does neuropathy cause diabetic wounds and amputation? Diabetic neuropathy can lead to diabetic wounds because neuropathy limits the nerve's normal abilities. By restricting normal nerve function, the body can't communicate with itself properly. Neuropathy is a sensation many Americans feel. Unfortunately, neuropathy afflicts more than 20 million Americans. Those with neuropathy lose sensation in their hands, arms, feet, and legs. Because neuropathy makes it impossible or improbable for diabetics to feel their hands, arms, feet, and legs, it becomes unlikely to feel a wound as it develops on the skin. In the most advanced cases, diabetics can step on a dirty nail poking out of a floorboard and never feel a thing. One of the best ways to deal with neuropathy is to perform daily inspections of the limbs. This is how you can identify wounds right away. Without carefully inspecting the body, it's possible for deep, infected wounds on the lower extremities to remain for days, weeks, or months. Delays like this are what breed infection. Wound care needs to happen instantly, especially for a diabetic, in order to avoid amputation and curb the spread of gangrene. What are the other causes of diabetic amputation? Peripheral artery disease. Peripheral artery disease restricts blood flow from the arteries to the lower extremities, including the feet and legs. With peripheral artery disease, diabetics are more vulnerable to ulcers and other infections. PADs is another example of how poor circulation and blood flow can have devastating consequences for diabetics. Small wounds. Because diabetes interferes with the body's natural healing, it automatically increases the risk of amputation. For diabetics, even a small, seemingly innocuous cut can become infected, chronic, and non-healing. And that's why it's important to keep an eye on infections. Small cuts can become chronic wounds once infection spreads into the bone. This is what diabetics need to avoid at all costs. Blood clotting and poor circulation. For non-diabetics, when injury occurs, the body naturally responds by beginning the healing process. This is dissimilar to diabetics. When a diabetic wound occurs, it is met with slow healing and a restricted response. This slow response is marked by the blood's inability to properly clot and flow efficiently, and by the body's inability to protect itself from harmful bacteria. Blood vessels are unable to bring much-needed nutrients and oxygen to the wound. And this is the crux of it, because this interferes with the white blood cells, and it allows an ulcer to form. Diabetics already have poor blood circulation, and this compounds the already existing process of wound healing, leading to more vulnerability towards infections and ulcers. Diabetic amputation is preventable. According to World Health Organization statistics, amputations performed to the lower extremities are 10 times more common in diabetics than in non-diabetics. However, there is light at the end of the tunnel. Only 15% of amputations were non-preventable, meaning that 85% of these amputations are completely preventable when early wound treatment intervention is used. We'll say that again, 85% of diabetic amputations were avoidable. Types of amputations. Full limb. For most people, when picturing an amputation, they envision the removal of an entire leg or an entire arm. This simply isn't so. In reality, amputations are used in varying degrees when it comes to deadly infection. Entire limb removal is done only when the potential to heal is unlikely and the infection is so putrid that your life is threatened by the limb remaining. Partial limb. Isolated wounds could mean partial amputation. For example, a partial toe removal or partial finger removal. In these cases, the amputation occurs in order to remove infection and stop it from spreading to other areas of your body. In other examples of isolated wounds, patients have undergone partial foot amputation or a below-the-knee amputation. In these cases and in all cases of amputation, prosthetics can be used to gain back dexterity and a full range of movement. Prosthetics are an excellent choice for some patients. How can you avoid diabetic amputation? Most amputees go on to live happy, active lives and make sure they take care of post-surgical wounds. The majority are completely preventable. Following these measures can help with a more favorable outcome. The diagnosis and treatment of diabetes. For those recently diagnosed with type 2 diabetes, the disease can be manageable. Healthy eating, exercise, and strategic choices will help with some of the devastation diabetes can cause. It's important that patients not run from the disease. Don't get scared of a diabetic diagnosis. When people get scared and don't manage their diabetes, it eventually catches up. Instead, face it head-on, get a proper diagnosis and a proper course of treatment. Diabetes that remains undiagnosed or untreated can threaten your health and physical well-being. This goes beyond diabetic ulcers and infected wounds. Blood sugar issues can cause blood to thicken, which results in the heart needing to overwork. With this, you'll be at a higher risk for obesity, heart attack, stroke, vision issues, blindness, teeth infection, gum infections, kidney damage. It is crucial for diabetic patients to find a good doctor and work with them to stabilize blood sugar. You can stabilize your blood sugar with tweaks to your diet, like reducing sugar and carbohydrate intake. Carbohydrates are dangerous for diabetics, and the sooner they are reduced, the better. Starting a diet plan that uses lots of whole foods will naturally work to get your blood sugar regulated. Here are some things diabetics should eat. Healthy fats: avocado, almonds, coconut oil, salmon. High-fiber foods: fresh veggies, whole fruit, sweet potatoes and beans. Fresh herbs and spices. Lean proteins: eggs, grass-fed beef, poultry, Greek yogurt. Other ways to get blood sugar levels intact are regular exercise, regular consumption of water, and effective stress management. Most importantly, be aggressive when caring for diabetic wounds. Why? It's simple. Diabetics can cut their chances of amputation in half by learning to identify diabetic wounds immediately. Again, as you learned above, Proper daily inspections begin with the feet and go to the other extremities. We look for wounds because, with neuropathy, we may not realize we've gotten a wound until it's too late. Contact us today for skin graft treatment in Orange County, California. Dr. Farid Banamad is a board-certified physician specializing in emergency medicine, wound care, and pain management. Our team will work with you to create an individualized treatment plan that meets your needs and unique conditions. Our clinic includes highly trained and experienced physicians, registered nurses, and certified medical staff who work together to provide you with the highest standards of wound care treatments. For more queries, please contact us on 833-700-0998 and visit our website, www.woundcareoc.com. Thanks for watching our video.